What is PRP? PRP stands for Platelet-Rich Plasma. It's a treatment option which involves us taking some of your blood, about 30 mils, and processing it to make it more concentrated, and means the different components of the blood separate. And that means we can choose to give the top part of that blood, which has the platelets in it, and that part means that you'll have the platelets having their effect, which is the concentrated growth factor effect, and the other parts, like the white cells and the red cells, aren't injected. It's a course of 3 injections, which are given 2 to 4 weeks apart, and people can notice a difference after the first injection even. All PRP isn't the same, and there's 2 factors which determine that. One is that we're actually starting with a patient's own blood, and everybody's blood is different, and the concentration of their platelets and the amount of platelets in their blood is different. So the end product, no matter how you process it, will be different for every single patient and probably every single time you give it. And the second part is the way that it's processed. There's different machines, so there's different centrifuges to spin the blood, and also different tubes that different companies provide, and they all have a different concentration that they can achieve. PRP has been around for a very long time, and orthopaedic surgeons have tried to use it everywhere for every problem. And because of the differences in patients' blood that you start with, which affects the quality of the PRP you subsequently inject, and the many different types of processing which can occur. There's different machines and different tubes, that oils ain't oils, and the actual PRP which you have can be different. So it can be hard to get scientific proof to show an effect one way or another. And so the research has taken some time to actually prove where we should use it. But it has been tried for many different tendon injuries, ligament injuries, different types of joints for different types of arthritis. The best evidence for where it has its best effect, and is the number one, is for treating knee arthritis. When it's compared with other types of injections, it has a better response for patients, so patients get a better result, and it has a longer lasting result. For some other areas like tennis elbow, where my first line treatment is actually different types of physiotherapy and avoiding certain activities which hurt, I view any sort of injection as second line, but with the different safety profiles, comparing a steroid injection to, say, PRP, I would probably prefer PRP in that instance. For knee arthritis, always prefer PRP over a steroid. For example, the side effects of steroid injections, or the things that you need to consider, are that we can't operate within 3 months of a steroid injection because of the risk of infection. That doesn't apply to PRP. And if steroid cortisone leaks out when we're performing an injection to a joint, it can make the skin have a pale area. And diabetic patients, for example, their sugar levels can rise, their glucose levels, because of a steroid injection. Whereas PRP is a part of your own blood being injected back into you in a different place, and so those risk factors don't apply. The tubes in the machine that I use have that potential to get the patient's PRP to 1 million platelets per microliter, and to concentrate it at 4 to 5 times from their starting blood. The strongest amount of PRP they can find is what to look for, and that means that the way it's processed, you can't choose your own blood, you can't change your blood, so you're only going to get PRP which is made from your own blood. The only variable that can be selected is to make sure that the machine being used is the appropriate centrifuge, and as well that the tubes that are being used to process the PRP can make sure that they get the concentration of platelets high enough So that means we're looking for 1 million platelets per microliter, and we're looking that the difference between your starting blood and the final processed blood has 4 to 5 times the number of platelets in it.